to start this off, at Connect, we believe that whenever possible, we want to elevate the voices of people doing this work in the community. And so we asked some of Connect's member representatives and partners to share in their own words why LEAD is so important to them and their community. So we'll play this video now, and then at the break after this session, we'll also play another video that I hope you stick around for, that we'll talk with some of our other partners.
Hi, I'm Tim McLaughlin. I'm president of Asmal Borough Council. And if somebody said, Tim, tell me about LEAD in 5 seconds, I'm going to say it's the right thing to do, because it is the right thing to do. It's the right thing to do for the people, and it's the right thing to do for your community. And what I really liked about it was, particularly with our, our fire and law enforcement, and the conversations that were coming about LEAD had us discussing some other multi-municipal issues that we were struggling with at the time. And one of them, obviously the biggest one, is, kind of the mental health and some of the poverty needs. The conversations with LEAD and the LEAD network has been phenomenal. It's everything I thought it would be. And I look at it, the benefit to the officers. And I know everybody says the program is diverting people that may be struggling from behavioral health needs and or poverty. But our officers, many of them are not equipped for those kind of conversations, and aren't equipped and to be able to handle certain situations on a recurring basis. Well, I'm excited. Everybody else in the cohort seems to be equally as excited, and look forward to getting it moving.
So why do I think LEAD is important? I think LEAD is important because it's a program that allows us to use our resources wisely. It is a way that our police officers can come in, and instead of adding to the prison system, they can add value to someone's life by sending them to places where they can actually get help, and that there are resources so that they aren't in these positions again later on. I've been talking about this with a lot of my constituents as I've been campaigning, and I think it's really important to understand that sometimes we can't take big, huge steps, right? This is a small step, but it's something that's doable, right? And it's something that we can all do. And it's also something that the law enforcement officers are in support of. It's a program that came from their ranks, right? It started in Seattle and now it's here. And I think having their support has really been helpful in terms of how it can be implemented. We're all on the same team. And I think this puts us in a direction where we can really use our resources wisely, and that the people who are coming into the program can really get the help that they need. These are the people that the police officers see every day on the street, right? They know these folks. They've been sending them to prison over and over and over again. And instead of repeating this process, we can stop it, right? And we can have a different outcome. Because if we keep doing the same things, we're going to keep having the same problems, right? And this is a way where we can have an intervention and change the outcome.
My name is Tom Caulfield, and I've been a magisterial district judge since 2010. I serve the communities of Braddock Hills, Chalfont, Churchill, Forest Hills, and Swissville. All 5 of them are committed to the LEAD program, and I'm very excited to be a part of it. Before I became a judge, I was an Allegheny County public defender for 19 years. So in 30 years of being in the criminal justice system, I've seen that for some people, the system simply doesn't work. I've had a number of clients who were repeat offenders, and on the bench, I've had a number of repeat offenders. And most, if not all, suffered from either mental health issues, substance use disorder, or a combination of both of these things. Now, the justice system has chosen to do the same thing over and over again with these people, to arrest them, to prosecute them, to convict them, to incarcerate them, and then to repeat the process. These are the people who really need the LEAD program. They need treatment, and they especially need guidance in their treatment in order to change their behaviors. We can and do punish people over and over again without having any effect whatsoever. But by getting to the root of the problem, we can resolve the issues that they're suffering from change the behavior, which has been the goal of the justice system all along. We're just getting there by a different route. I think that through the LEAD program, we're going to be able to effectuate great change in the lives of people and in the community at large. And I'm very excited to be a part of it, and I look forward to what's next. Thank you.
In May of 2021, Governor Tom Wolf signed the 14th renewal of the opioid disaster declaration he originally signed in January of 2018. This public health epidemic isn't going away, and the 2020 pandemic has only exacerbated it. Some recent studies have shown that overdoses are reaching all-time highs in Allegheny County, and that the lethality of the narcotics on the street is increasing as well, with the proliferation of fentanyl, in addition to the heroin and prescription painkillers rampant throughout the region. The possibility of fatal overdoses multiplying in our communities is significant. Communities need applicable and effective public policies to address these issues as they evolve over time. Law Enforcement Assisted Diversion, or LEAD, has proven to be an effective, malleable, consensus-building tool for communities to develop strategies to combat the epidemic. The power of LEAD is its adaptability. Nobody owns this process. Instead, communities can self-determine what they want their diversion programs to look like. This is accomplished through the advice and best practices of the LEAD National Support Bureau, as well as other participant communities. It's an incredibly effective tool for magisterial districts, communities, community organizations, NGOs, as well as police forces that are encountering individuals in substance abuse crisis or mental health crisis on a daily basis.
My name is Tim Komorowski. I'm the Chief of Police in the Borough of Millville. I've been in law enforcement for approximately 30 years. In this 30-year time period, I have experienced people that are in all phases of chemical addiction and mental illness. And I think we see a very strong correlation between the two. And one thing that anybody who's been doing this job this long, or not even this long, knows is that what we are doing currently is not working. We have way too many people that are addicted, that are being put into the criminal justice system and being saddled with an arrest for the rest of their life. They go on, if they do get treatment, if they stay in treatment, 20 years from now, they still have to explain convictions that are on their records. I think that there has to be a better way. LEAD came into the picture approximately 2 years ago. I was lucky enough to be part of the talks from just about the beginning. And I feel this program, not only is it going to help people down the line so that they don't have these very cumbersome convictions on their record, but it's also helping getting them into the treatment that they need. Addiction is a disease. If we don't treat it like a disease, we're not going to go anywhere. No matter where you are on the spectrum, if you totally are sympathetic or you're totally not sympathetic, you have to understand that it's counterproductive that people still have to explain these convictions so many years later, and it stops them from getting the type of employment and the type of jobs to support their family they need. So I strongly believe in the LEAD program.
My name is Richard Garland. I'm an assistant professor for public health practice at the University of Pittsburgh Graduate School of Public Health. I run a few projects there at the university. One is called GRIPS, Gunshot Recurring Injury Prevention Services, where we see the gunshot wound victims that come into 4 major trauma units: Presby, Mercy, AGH, and Forbes. And what we do is offer them services. And our main goal with GRIPS is to see if we can stop recidivism. The second project that I do is we review all the homicides in Allegheny County, looking at the trends. And based on some of those trends, we hope that we can work with young people before so that they don't follow in their father or loved ones' footsteps and committing crime. And the third project we do is called Reimagine Reentry, working with men and women coming out of the state system, where we doing training and jobs. I say all this to say that all our support that we have for Connect and LEAD and providing opportunities for young people by giving them training opportunities, job opportunities, so that they don't go down the road of some of the work that I'm doing now after the fact. We believe in working with these organizations so that men and women don't go to jail. So thank you, LEAD, for all the things that you're doing.
Thank you to all of our partners who gave us videos to share today, and all of our partners in general. This work really is because of you and driven by you. And Kelley and I, Kelley is our community engagement coordinator. We are just going to share a little bit about where we're at with LEAD in Allegheny County, where we're going, and how you have opportunities to get plugged in. Let me share my screen really quickly. Okay. So first off, I just want to say a little bit more about Connect. This is a map of Connect that is a little bit outdated just because we are continuing to add new municipalities all the time. So the Congress of Neighboring Communities brings together the city of Pittsburgh and 40 surrounding municipalities, as well as partners from the county and other places to really work on cross-boundary issues. There are 130 municipalities in Allegheny County, and we need forums to be able to talk together about how we make policy changes, not just in one area, but really as a region to have the most impact and the best effect. Connect has been working on public safety and public policy for or surrounding public health and public safety for at least 10 years now. We started with the Connect Community Paramedics program. We've been working on solutions to the opioid overdose epidemic, and that's really where I came in. I joined the team at first as an intern, and then I worked for the health department for 2 years, working on helping communities understand how they could have an impact on opioid overdose deaths in their community. So that's really where this work began. Just a little bit more of that history. So in 2019, Connect had been working on figuring out how to handle mental health crises, how to handle opioid overdoses, and all these things for a couple of years at this point. And there was an opportunity from the Allegheny County Health Department. Our executive director, Lydia Morin, came, I believe it was on a Thursday, came to one of our executive committee meetings and said, hey, is this something you're interested in? We have an opportunity to potentially do a pre-arrest diversion program and get funding for it. Would you want something like that? I think it was just over the weekend. By Monday, they came back and we had over a dozen communities say, yeah, our police chiefs are interested, let's go for it. And that's really where this started. So from there, I joined the team and we worked on what we call the pre-planning project with Kat Sutherland, who's at the health department. And funded by the Staunton Farm Foundation and the Heinz Endowments, we created a LEAD research to action report, which is in the chat. I encourage all of you to read it. There's some really good quotes from a lot of the stakeholders that we talked to. We talked to more than 60 stakeholders between people with lived experience, people working in the county justice systems, people, law enforcement, local governments, all sorts of different people. And really what we were able to find from that is that a lot of people are really interested in making changes, that there are a lot of things that people recognize are not working in the system. And lots of us are here wanting to change that. And that's why we're here today. So please take a look at that report if you have a second. We were also able to go take a trip to Seattle to join the LEAD National Support Bureau for their LEAD Learning Conference and learn a lot from there that we've taken back since then. Connect's role in this project is really about facilitation and helping to bring everybody together. So I, Kelley, Kaylee, Sarah, everyone on our team, we're working to make sure that all of this goes smoothly and that there isn't just input from some areas, but there's really meaningful input from all of the stakeholders who want to be at the table. So please let us know if you would like to be at the table. We're going to have some more discussion about how that can look later on. But please know that we are here as a resource and we are really just trying to facilitate the process that all of you are really out there in the community leading. I want to ground this just a little bit in our overdose numbers. We know that last year in 2020 with the pandemic, overdoses increased 22% over rates in 2019. This is a huge issue, and we know it's still ongoing. And we know that the things that we've been trying to do, whether for overdoses or mental health crises or housing, lots of these things, we know that we need different responses. Just a couple more charts about where we're at, just to really take a look at how the pandemic has affected things and how we are needing new and different ways of approaching these issues to really make an impact. And I also like to talk about racial disparities, because we know there are a lot of racial disparities all throughout our system, whether it's an overdose or the jail population or arrest rates. Many people think of opioid overdoses as a white people issue, but really it's across the board, but currently it is affecting Black people at very high rates. And it's something that we need to make sure that we are addressing. So in our pre-planning study and things that we've been talking about all the way along, we're hearing a lot of the same things from many of the stakeholders that we're talking to, including many of the people on this call. Really, that LEAD is a tool for communities to help reduce recidivism, increase public health, public safety, quality of life, and really continue to invest in our communities and find better ways of engaging with people who are continually cycling in and out of the criminal justice system. A lot of our stakeholders talk about how it's a tool for police, that a lot of our police are experiencing burnout, and many of the law enforcement officers that I've spoken with really want to do things to help and often are stuck not knowing how to engage with somebody who has substance use disorders or severe mental illness, things like that. And also that we just really need upstream intervention, that this can't happen downstream. We need to start earlier in the process. We need to work to figure out how do we create pathways other than just arrest. And that we need something that's not just going to be totally top down or totally grassroots. We really need this combination of both bottom up and top down that can really understand the needs of communities and make sure that all of the voices that need to be heard are able to have an input on have input on this program. And I'll pass it off to Kelley to talk about where we are now in this process.
Hey everybody, thank you for joining us today again. So where we are now, last year in September of 2020 at our legislative session, Connect passed a resolution supporting the LEAD work. We also have developed LEAD subcommittee meetings bi-weekly since November 2020 as well. That came from our larger public health and safety working group. We took a lot of members that are interested in talking about LEAD and working with LEAD in their communities. We made it a smaller group, met more frequently, and talking about how to get things implemented in their communities. We've also had 14 plus municipalities pass a resolution supporting LEAD this past year. And we've also had funding commitments for project staff and 3 case managers for initial pilot cohorts when we get up and running. And we've also had technical assistance from the LEAD National Support Bureau, which has been just so helpful in kind of helping us, giving us that technical assistance we need, giving us that mentorship, supporting us through the initial piloting process. And I'm sure, as most of you know, Allegheny County is complex. I don't think we needed to state that, but just in case, I know everybody here knows about how fragmented our county is, how large it is. Just from, you can see from the slide, we have 130 municipalities and 108 municipal police departments. We have 1.2 million residents, and over 75% of those live outside of the city of Pittsburgh. So what this, for us was, well, how are we going to do this with a county so fragmented and complex and with so many people involved? If we go to the next slide. So how we're going to do this is piloting LEAD. We're going to try a cohort model. So the cohort contains 3 to 5 contiguous municipalities that can expand after the initial pilot. But this idea was brought together from the members of our LEAD subcommittee. They like the idea of working together. They like the idea of, having an anchor community that could support maybe other communities that don't have as many resources as they do. And they like the idea of working together to bring this to their communities. So we thought of a way, how can we find out who's interested in this, who has the capabilities of doing this, who would want to work together. And so our subcommittee said they would like to have some sort of form to be able to submit to. So there was a cohort interest form created, and they'll be submitted for review. And then what the cohort will share would be a cohort level policy coordinating group. They'll share case managers, and they'll also share the operational working group and the community leadership teams, which I'll talk about next here in the next slide. So creating the community leadership teams. As Brendan talked about in his keynote, the community leadership teams are really about engaging the community, being transparent, being the group that kind of holds the program accountable, is transparent, is there to listen, to what the community needs. So it really is about engaging community voices and including, as you can see, we'll have people with lived experience, advocates, faith leaders, business leaders, and other community stakeholders involved. This is to ensure LEAD is grounded in the needs of the community, and it'll be starting in regions interested in LEAD. So I'll be the person that you'll most likely see if you're interested in the community leadership team. I'll be starting a lot of this outreach very soon. And if you'd like, stick around for the community leadership team discussion at 11:30, where we'll talk about that in more detail. But again, this is such a key part of the model, and just such a great way for you to get involved, your community to get involved, and just to make sure that it's very transparent and we're holding the program accountable for its success. And I'll pass it back over to JoEllen, who's doing a lot of the work on the policy coordinating group.
Thanks, Kelley. A big important piece of the policy coordinating group, which Brendan touched on last week. And by the way, you can view all of the videos from last week on our Summit website. Those will all be made available to you. So if you missed last week, you're welcome to go back and look at those. So the policy coordinating group really is the body that comes together to figure out what the policies and procedures are going to be. So all of those different decision makers who may need to make changes in order to make the program work can come together to figure out how to set the policies and procedures. So we have worked with lots of different stakeholders to figure out what the policy coordinating group might look like. We're still in the process of being able to actually convene the first one of these. So this is kind of what we're thinking of, that we would have the county level, which would have stakeholders both from the county and from the municipalities and from each cohort that is interested in doing LEAD, as well as advocacy organizations. And then we would also have a cohort level policy coordinating group that could make decisions at the cohort level. So the county group could set policies for the entire county and make changes at the county level that would allow for LEAD to take place. And then the cohort level would really be important for figuring out how exactly it's going to work in each different cohort. So that's just kind of a look at this. This is not set in stone. We are continuing to work with lots of different stakeholders on what the governance looks like. Please reach out to me if you have any questions about that or want to talk further. So I'll pass this back to Kelley to talk about the harm reduction case management.
So the harm reduction case management is really a key point. Again, as Brendan talked about in his keynote, this is case management done in a very different way. It's very boots on the ground. It's very intensive. They say it's the secret sauce for LEAD. So we're looking to fund 3 case management staffs to start out. We would contract with social service providers for case management staff. We're looking to see 1 case manager for 25 to 30 participants. And case managers will work with participants long-term. And that's what's so special about LEAD. It's unlike most case management, I think, that exists out there right now, where that long-term connection with the participant isn't happening. This is, you are in the program, long-term. It does not matter if, you are still using a substance, or if you're arrested again, or if you're coming into contact with the criminal justice system in other ways. Your connection with this case manager is the key, to this program and your relationship, and, working with you where you're at to make sure that, you're connected to those services that you need to improve your life. And this is just, if anybody's interested in getting involved, our goal is to give everyone with a stake in LEAD a seat at the table. So please, you'll get a follow-up survey at the end of the summit. So please fill those out. Send us your contact information, email addresses. Let us know what you're interested in being involved in. You can join a community leadership team. You can sign up for our email list to get all kinds of updates and newsletters from Connect. You can attend training and education events that we're going to provide throughout the rest of the summer and the year. And we can also work with you if you're interested in introducing LEAD into your community. We're more than willing to come out to your council meetings or your neighborhood community meetings. If you'd like us to come out and talk to your police departments or your other local elected officials, your borough managers, we're more than happy to do that. And thank you all. We have our contact info here. You can reach JoEllen and I at the emails below, and we hope to talk to you more in our breakout sessions later this afternoon.